Good afternoon.
Howdy.
How are you, Dr. Stone?
I'm doing just fine, Dr. Lamb. How about yourself?
Good. So you've got Joe Lamb and Michael Stone with you for your Monday afternoon coffee break, and we're here to talk about journey, traveling, moving from point to point. Sometimes it's an actual physical journey, sometimes it's a spiritual journey, and sometimes it's an intellectual process, like the growth of a field over time. And we're going to talk about all three of those today as they specifically relate to our work 2 weekends ago at Harmony Hill Retreat Center up in Union, Washington, and our upcoming retreat in 2 weeks at Feathered Pipe Ranch in Helena, Montana.
Yeah, both Harmony Hill was a great event, and we are really looking forward to Feathered Pipe, and it'll be a gathering so that we can one, touch base to with where we've been, and two, vision on where we're going with our health and our understanding.
Yeah, exactly. And we thought we'd talk a little bit today about the journey. Like, how did functional medicine become functional medicine? Who were the thought leaders that influenced it? And then talk a little bit about the same for kind of cognitive behavioral therapy and for like transpersonal psychology. And I really want to make my apologies up front if we leave anyone's favorite practitioner or scientist or researcher or philosopher out of our timelines as we do this.
Well, let's get started. What do you think?
Yeah. So I think we would both agree that Jeff Bland is looked at as the father of functional medicine.
Well, I agree. He certainly, he obviously helped with his spouse, helped start the Institute for Functional Medicine, and with the work of Sidney Baker, Leo Gallen, and from a clinician standpoint, David Jones. I think that yes, absolutely, that group of four was key. And then I know it was very pivotal, the meetings and times that where Jeff Bland and Joe Paggiorno gathered and visioned the future of medicine.
Yeah, I mean, that was the Northwest kind of, I don't even know what they called it at the time, but it was a small grouping of people having discussions in the late 80s about what medicine could look like. And they actually had back and forth discussions about what to call it. Whether it was still going to be called alternative or complementary and alternative or holistic or integrative. And they settled upon the word functional, even though functional had some negative connotations to it. They settled on the word functional because they were all about understanding how the body functioned and the importance that brought to the outcomes.
No, that's exactly true, and it was really a desire to begin to weave the brilliance and the observations of some of the systems medicine heuristics of the past that are still practiced today, Ayurvedic, traditional Chinese medicine with the foundational knowledge of naturopathy and wed it to the science and evidence-based knowledge and heuristic allopathia.
Yeah, I mean, going back to intellectual roots like Archibald Gerard, the Scottish physician at the turn of the last century, who started talking about uniquenesses in individuals contributing to diseases, moving forward to the 1950s, and Roger Williams talking about biochemical individuality, the work of Linus Pauling, and Abraham Abraham Hoffer, looking at what they called orthomolecular medicine at the time. All of those roots really contributed to incorporating like the depth of naturopathic medicine and coming up with the science-based approach to understanding cause and describing function that you're right. A lot of important practitioners contributed to, who had been breaking ground on their own along the way.
And through that was a groundswell of also recognizing that as we were moving through the 60s, 50s, 60s, 70s, chronic disease was becoming more dominant, and the consumption of the healthcare dollar and our algorithms were not working.
Yeah, and also the recognition. I mean, it is still amazing to me that William Osler said at the turn of the last century, 1800s into the 1900s, Osler talked about it's more important to know the patient who has a disorder than the disorder the patient has. And to think that, 110, 120 years later, we are still fighting that battle with traditional allopathic medicine. And he was one of the founders of allopathy.
It's very true. And what else does really, I would say that the two mentors that really brought forward patient story was obviously Sidney Baker and David Jones really tried to encapsulate and bring the whole patient encounter forward, which really builds on the brilliance of it stands on the shoulders of long traditions in healing and in trying to improve health, and that is understanding the patient's story. We understand through data through research, that when it comes to being able to figure out a problem, still nearly 80+% of the information needed to decide on the correct diagnosis and the correct next step is in the patient history, and only between 9 and 13% is in laboratory data or in other imaging. And so we kind of lost track of that in many ways in our current state, in that how often do you see or you've been handed a wad of biomarkers of lab work, of imaging studies, and says they're all normal, yet the person is functionally very dysfunctional, or the person is sick. And so it causes us to go back to story.
Oh, absolutely. And hence, every once in a while I get pushback about the length of our history form. Like, I think probably you, like me, are using a high teen number of pages. Like, I think I'm at 18 or 19 pages for my history form for the first visit. And we're struggling in our development of the app to figure out a meaningful way that people who are used to 1-minute sound bites complete their histories. But, the reason we do it, and I think it becomes crucially important, but the reason we all do it is because of, it allows us not to have to be a scribe as much as we get to be then teachers if we're not having to ask the question and note it. If it's on the history form, staff can enter it for us. And then we get the opportunity to tell the story back, as David so often speaks to, tell the story back to the patient so they understand that you understand where they're coming from, and then they'll better recognize where they're going forward from.
And isn't that true often when we journal and when we start trying to reflect on decision points and the path that we're on, often by reflecting and seeing those really trying to rediscover or understand those inflection points for us, we see better where we've been and in the timeline of our journey. And I think that's obviously very true in health. I don't care how complex the problems are, that when we're able to spend the time and fill out a timeline of when we last felt well or the timeline of our condition, then we begin to understand better the different factors that are driving or causing that condition to persist.
Yeah. And, it's interesting. We just taught the timeline at Harmony Hill, and you and the work that you've done with Leslie, your wife, Dr. Leslie Stone, and your daughter, Emily Rybaum, for Grow Baby, taking it back before we're born. But I was just reading some shamanic writings and work, and the really fascinating thing for me in that regard is the whole kind of concept of shamans see our past lives playing such a role, and the Jungian archetypes, and talking about sometimes when trying to heal some of the burden of some of the life traumas that we have, or the life brokenness, kind of the brokenness of our dreams, that you have to go back and probably have to heal ancestral stuff and past life stuff, and even maybe cultural pieces in order to gain wellness. And so, I can foresee the timeline of the future being even more complex.
No, that's exactly true. And thus when we start thinking transgenerationally and we start understanding the epigenetic drivers of transgenerational health, suddenly the observations of some different healing heuristics, for example, in shamanism that looks at past life archetypes. It caused me to sit down a little bit and ask a few more questions about the patients, or even my grandparents or great grandparents or great grandparents, to understand their story, because we understand in the complexity and the miraculous aspects of the environment around the genetics, we are influencing what the environment that turns genes on and turns genes off, and actually helps cause set points to occur in how we respond to stress, or how, if we have any emotional set points. It's fascinating. It's a little mind blowing, I got to tell you, Joe. I mean, it doesn't fit into my algorithm that I'm so comfortable with of what to do with acute pharyngitis that I learned in medical school.
Yeah. I mean, I similarly, when I was reading this book, and I may have to run and get my Kindle so I can credit the author, but she was, she's talking about shamanic healing and dealing with life traumas and using EMDR. And then in the next paragraph, she's talking about Jeff Bland, Bruce Lipton, and epigenetics. And, it's, and that epigenetics may be those bookmarks that carry, our stories forward across generations and across lifetimes. And it really is a fascinating piece to consider.
You mentioned the pregnancy work, and what's fascinating is we know that preterm birth in the grandmother increased preterm birth risk in the mother, which increased preterm birth risk in the daughter, which can increase preterm birth risk for multiple generations beyond that. And all you can do, what you can do though, is you can change the environment during pregnancy. And if you can break that cycle of preterm birth even once, then the epigenetic markers for that causality is broken and reset. And so I think there's a lot of plasticity and a lot of healing that can be done by being very mindful and present, no matter where we are in our health and well-being journey.
Absolutely. And, when you start thinking about the transpersonal side of it, the work of so many people in that field, but, kind of the blending together of cognitive behavioral therapy into a deeper kind of transpersonal psychology is an interesting one. You've got the kind of roots of, Jung talking about, obviously archetypes, but also talking about alchemy and talking about the deep soul work and the meaning of the unconscious and the people moving forward with that and talking about spirituality. And then suddenly you have people like Walter Cannon who, did flight versus fight and the stress reaction and jump forward about 80 years later. And in the very same laboratories, you have Herbert Benson in the same physical space studying the relaxation response and how people respond. And the fascinating piece being that Herbert Benson, when the transcendental meditationists came to him and said, look at what we can control that isn't normally controlled, he went and rented office space in downtown Boston, so no one at Harvard would know what he was doing initially, because it would have been considered sacrilege, in the Department of Physiology where he was working, endocrinology and physiology and stress response. And look at where we've come, with Seligman's work and Burns's work and Mason's work and McEwen's work and Luppier and, Sapolsky, all the scientists who've laid out the path, and then clinicians like, Jim Gordon and John Kabat-Zinn and others who are using these techniques for trauma and the such like.
Yeah, under the Clinton administration, they started looking for research hubs, right? So there are research hubs in Chapel Hill, there are research hubs in San Diego, and each of the research hubs had their focus. The San Diego Research Hub really had a focus on genomics, as well as up in Seattle. what you were describing with the same physical space and all these legendary leaders in this field, they had their own hub before we recognized hubs.
Yeah. Oh, absolutely. I mean, all of the names that I mentioned, most of those names that I mentioned before I got to the clinicians had all really come out of University of Pennsylvania and Rockefeller, and they were all interconnected. And, when you think about Andy Weil, Jim Gordon, and Ram Dass and Timothy Leary were all at Harvard at approximately the same time. And, they weren't all classmates, but they were all in the med school and they were all interconnected. And Jim Gordon went on to be the first director of the National Center for Complementary and Alternative Medicine when that office opened in the 90s under Clinton, I guess it was. And, you just look at all of these interconnected pieces, and some of the stories are wonderful ones, and some of those interconnected stories are a little complex. I don't want to leave Hans Selye out of that whole stress discussion, but he was, he did all that remarkable work about stress physiology that led to people understanding it enough to start talking about treatment approaches. But, the story that Michael Pollan relates in Changing Your Mind about how Andy Weil kind of was very sort of nefarious in his dealings with Timothy Leary. And I guess his name was Alpert at the time, Ram Dass's original name, when he was faculty before he went to India. But there was bad blood there for a lot of years. And eventually Ram Dass forgave Andy Weil, it's my understanding.
You mean humans were being human?
Yes.
Oh, that's surprising.
So, but, when you think about some of the people, some of the people who have contributed to all of this, and, we were at Harmony Hill, which is a cancer retreat center, and, talking about journey, and it made me think of Jeremy Geffen, who wrote A Journey Through Cancer, or Murray and Porzorno, who, did how to treat and prevent, or how to prevent and treat cancer with natural medicine. And they did that with Birdsall and Riley. I mean, the number of books that have been out there, and, and how rich some of the intellectual history is, going back to the Transcendentalists and some of their remarkable statements, Thoreau, Emerson, I particularly think of, Muir, that whole group, and what they thought and what they were contributing to. It's fascinating where we are now.
It is. So do you want to describe the macrame that we'll be weaving a bit more in Feathered Pipe with the folks?
Sure. So I think we would all agree that wellness is more than the simple absence of disease. And if we postulate that, then we have to say that you can't really define wellness by using markers of disease, risk factors or, biomarkers. And instead, you need to be looking at function. And, when you start describing function, you've kind of got a holistic, almost holographic view, going from the very large to the very small, going from planets to populations to communities to families to human beings to organs to cells, right on down. And in doing that, you can take a microscopic view or a macroscopic view, sort of the metabolic and the physical. Then you've got your cognitive function and your emotional function. And all of those people all those functions determine, the kind of the outcome, the outpouring. And, hence in our Lifehouse work, we moved past a little bit just the 4 functions to add a 5th function, which was behavior. Because, in many ways, behavior is kind of the outward expression of the integration of all of those other pieces, parts. And kind of that inward expression in an actualized mind, body, and spirit. Because, without a true understanding of, what our purpose is, behavior and function doesn't really have a direction. So as you start looking at all of those pieces and start saying, where are we going, without a good solid touch point kind of for what's important, meaningful, and valuable in our life, kind of, what our dreams were. If we've lost our dreams, if we lost our vision, then there's the ability to create a lot of stress, a lot of angst, and a lot of dis-ease, progressing right through that lack of wellness all the way to full-blown disease. And, and as such, reestablishing what we want and then using the functional medicine tools, the antecedent, the triggers, the mediators, creating a matrix, creating a timeline, taking the timeline a little step further with the genogram, which does have that transgenerational component to it in terms of timeline. And, moving forward, we can kind of help people craft what wellness means to them, how they can successfully change their behaviors to get what's important to them. And we're hoping, obviously that can be a life's work for a person. And, obviously we'd be deluded if we thought that in a 3-day weekend or a 5-day journey that we could get someone to do all the work, but we can help people initiate the work and get off to a good start.
Yes, and that's what we're going to be spending time doing at Feathered Pipe, and we're going to tie in some very clear experiential touch points, and it should be a great gathering in a beautiful part of the world with an exceptional energy in that very special place, Feathered Pipe.
Yeah, and we have about 4 places left if people are interested. Either go to josephlammd.com or to the Feathered Pipe Ranch website, and there are links there that would take you to registration. And it's going to be here before we know it. 2 weeks from today at this time, right now it'd be 5:30 Mountain Time. We're going to be looking at each other, you and I and Susan Buell and Courtney Suter, having our last kind of faculty meeting before we head up the road a little bit and go to the dining hall and have dinner with everybody. And then afterwards, we're going to kick the program off at about 7 o'clock.
Well, that'll be a great time. So great vision, Joe. And thanks for the discussion.
Thank you, sir. And thank everybody for for listening, old friends and new friends, and take care.